Coming up on the program, a look at the future of dental insurance with the CEO of NCD, a dental insurance company, then deciphering your medical bills.
Support for What's Health Got to Do with It is provided in part by the American Brain Foundation invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at AmericanBrainFoundation.org. Rethreaded knows human trafficking destroys lives, but they also know it's not the end of the story. Rethreaded believes in the potential and power of all survivors to reclaim their lives. Visit rethreaded.com to learn more. And Elevate Med. Through mentorship, leadership development, financial literacy, a robust peer network, and tuition-based scholarship support, Elevate Med is dedicated to the next generation of diverse physician leaders as a tangible step towards the eradication of health disparities. More at elevatemed.org.
From the moment we're born to our last breath, every American embarks on a journey through the intricate maze of the healthcare system. These are their stories, one life at a time. Today, we meet Colin. Colin is a 34-year-old who noticed occasional tooth sensitivity when drinking cold water, but brushed it off. Over time, he developed a dull ache, a little swelling near the gum line, and pain while chewing. A visit to the dentist revealed the real culprit, a preventable but expensive problem, one that could have been caught earlier with regular care. What's the diagnosis? Hi, I'm Dr. Joe Servin, a practicing neurologist at Mayo Clinic and professor of healthcare administration and policy at Arizona State University. This is What's Health Got to Do with It, which looks at where and how healthcare intersects with your life, helping you get the medical answers you want. Now let's turn our attention back to Colin. The diagnosis? Dental abscess, likely from an untreated gum disease. Now, our teeth often give us early warning signs like sensitivity, pain, and swelling. But without regular care, small problems can easily spiral into big, costly ones. And unlike general health insurance, dental coverage often leaves patients navigating a very confusing and limited system. So today, we're taking a closer look at the future of dental insurance. What's being done to close gaps in coverage, improve access, and make preventative care the norm rather than the exception? Joining us is Sam Melamed. He is CEO of NCD Insurance, a company focused on innovating dental and visual coverage for the next generation of care. Mr. Melamed, Sam, welcome to our program.
Thanks so much, Doc. Great to be here.
It's so good to have you here. I'm going to start right into this. I have dental insurance from a completely different group than my medical insurance. And my simple question is, why has dental insurance been separated from traditional health insurance in the U.S.?
It's a great question, and there's a number of evolutionary factors. Really early in last century, when the first accident health plans were being developed, dental care was really seen as largely cosmetic. And so the entire dental ecosystem now developed a little bit later than the rest of the medical ecosystem. Initially, it was kept out due to costs, but also the professional and regulatory separation. Dentists advocated differently as the market evolved from the regular healthcare.
So many of us, and I'm included in this, we find our dental plans confusing. There are these maximums, there's these waiting periods, exclusions. I'm going to ask very specific. You're with NCD, CEO of that company. How are you all working to simplify this for those of us that are just trying to just get our dental checkups and maintain good dental care, if you will?
Your ears must be ringing because we talk about this at our leadership meetings all the time. It really starts with the human touch. NCD is the highest rated dental insurance plan in the country because we have such a strong focus on our member care team, on our education team, on our welcome concierge team, you're right, it is confusing, and it's really up to the companies in the space to say we're not doing good enough. We have to help make it more simple for our members.
I mentioned in our intro case, this was a story of where prevention or preventative care, cleaning, checkup, stuff like that, could have helped this person not have an emergency, if they will. What role, or could you expand a little bit about how preventive care plays in the ultimate control of costs for patients like me and insurers like you?
Yeah, preventive care is absolutely critical for a number of reasons. The most significant is that most dental issues really are preventable. Obviously, there's behavior that you can engage in at home in terms of good oral hygiene and brushing your teeth and flossing and things, all those things the dentists chide us for not doing well enough. But it also is a leading indicator of any number of other illnesses that going to the dentist, occasionally the dentist can find something that's much deeper than just a dental issue. We know the link between oral health and brain health is really starting to come into sharper focus. And so it's one of the core issues that we face all the time. When we talk to customers who are new to dental insurance, they say, we've been afraid to go to the dentist. We're fearful that they're going to yell at us for not brushing or be disappointed with the plaque buildup. And so that remains a barrier to a lot of people getting that preventive care, which is really critical to avoiding more significant issues in the future. It's one of the reasons why many of our plans offer 3 cleanings a year rather than the standard 2, because investing in preventive care not only helps the claims in the future because there's fewer cavities and other major dental work necessary, but it leads to much higher patient satisfaction.
I mentioned that when we started our conversation that, in the US, it's just historically, these have been separated, dental versus general medical insurance. Is there growing interest in bundling dental, medical, even vision coverage? Do you see that happening in the future, or do you think we're going to stay on these separate tracks?
Yeah, I would split up the market in a few ways. You have the commercial group health market, where many of the largest group health carriers in the country do have group dental offerings, and they've been quite aggressive over the last 15 years in building in packaged savings. So they want more members to get their dental insurance coverage from their core medical insurance coverage. You still in that market see that most of the business flows directly to the specialty companies because it is a niche specialty that does make a difference. We always joke that if your head hurts, do you go to the butt doctor or do you go to someone who really specializes in those issues? And dental insurance and dental care has really become a very specialized area. On the government funded side, in Medicare and original Medicare and Medicare supplement, there's really no dental coverage except for people with certain very extreme illnesses. Whereas in the Medicare Advantage marketplace, there are a lot of carriers that do offer some form of dental insurance as a supplemental benefit. And there too, we see that many of the Medicare carriers are governed by aggressive service SLAs by CMS for Medicare, but the embedded dental, because it's often a different company providing it, does not have that same level of satisfaction. In the standalone market, for people on an ACA plan or people on a Medicare plan that doesn't have dental coverage, it's really much further unbundled, and almost all of the business is currently run just by dental insurance companies. We do feel like being a specialist and going very deep creates some alpha, and it lets us solve problems that might be harder for other companies. So I think you'll see a continued push from health insurers to try and pick up additional product lines with their members. But I would be surprised 5 years from now if the market share is any different than it is right now, with most of the dental business being with dental insurance specific companies.
One of the things we talk a lot about on this show is telemedicine and AI. And I don't know how the technology, AI, and or telehealth is impacting the dental world. Is there such a thing as teledentistry, and where would AI come in play in the world of dental care, if you will?
Yeah, those are both great questions, and I'll bifurcate them a little bit. So
Okay.
teledentistry is absolutely a thing. Almost every major dental insurance carrier now offers teledentistry visits. There's some new apps coming online that let you scan your mouth with a camera and an iPhone or an Android phone that have some interesting diagnostic elements.
Cool.
And it certainly cut down a lot on emergency dental visits where a dentist can now call in a prescription for a painkiller or can recommend whether someone has an infection and they need to be seen quicker. And so teledentistry is a real thing. Obviously, the surface area on which it can be applied is smaller than in the broader medical ecosystem, where a dentist still does need to look in the mouth and do x-rays for many of the kinds of coverage needed. On the AI side, I think that AI is really taking off in the dental insurance industry in a few interesting ways. On the diagnostic front, the ability now for your x-ray in the office to be matched against your x-ray from 2 years ago or 4 years ago, and for micro movements to be detected is much easier with computer vision and machine learning and AI. And so a lot of dentists are using this in their diagnostics. They're also using it to know when to follow up with people and just have better compliance around that. So teledentistry really has made dental care a little bit more accessible. It's improved x-rays and diagnostics. On the claim side, there's also more auto adjudication. One of the frustrations historically that people have had with dental insurance is you come to the dentist and they say, it looks like you need a filling. And someone says, well, how much is that going to cost?
Right.
And I say, well, I don't really know. Can I get an answer if this is going to be approved? It's on the margins. And so the ability to get in-seat adjudication much quicker is there. And you also have much quicker clinical review. On the member care side, we are resisting the temptation to solve problems with AI. I know a lot of insurers are moving parts of their call center to say,
Sure.
let's have the IVR or the technology try and solve the problem first. We have taken a very human-centric approach. We love any opportunity to engage with our members and just talk to them about their day or their grandkids. You know, we have over 1,000 customers over the age of 90. And so the member care experience for that segment especially really has to have that human feel.
I love it. And to all of our listeners out there, you're listening to What's Health Got to Do with It on WJCT News 89.9. I'm Dr. Joe Servin. If you're just joining us, we're in conversation with Sam Malamed. He is CEO of NCD, and we're talking about the future of dental insurance, if you will. And we want to hear from you. Tag us on social media at jservin. You know, Sam, I am headed to my dentist this coming Tuesday, and I'm going to point out a criticism that some of our listeners make, that sometimes the dental insurance just feels more like a discount plan than rather true insurance, because I get my, like, here, start paying your copay now, and it does feel more like a discount as opposed to any type of coverage. How do you respond to that? Are changes coming to that vibe, if you will? Maybe it has to do with the company that I have my insurance with, which is not yours, I might add.
Not yet. Well, I would acknowledge first that this is a historic complaint, and it's one of the reasons why NCD built the first $10,000 annual maximum plan on the market in partnership with MetLife, was really a response to the fact that the total costs of dental care have now become more of an insurable interest. You know, initially, the reason dental insurance existed was because a company could pay for it. They could buy it on your behalf with pre-tax dollars. But now there's also a network effect where the strength of a network that your dental insurer has might provide 30-40% discounts before any insurance coverage. But to answer your question head on, we do believe the market is moving to much higher annual maximums. We were the first company in the market with a $5,000 annual maximum and are now the first with $10,000. Because we do see every year people have sometimes 10, 20,
Yeah.
$25,000 worth of work that needs to be done. And so I think the combination of the network discounts that you get plus going with a provider that actually has high value plans is the solution there.
Out of pocket costs, as you just mentioned, can still be significant. And I'm just curious, even though you've pointed out that you all and others have started higher maximums, are there new models, a value based insurance design that's being looked at for dental care? I mean, what is that being looked at?
It's a great question. And we see this all the time that the single most important factor to customer retention is actually their out of pocket costs, right? The premium is knowable, I can expect and I can budget for it. But people are nervous that I come in the dental chair and I just don't know what my out of pocket costs are going to be. So part of the answer is to have greater transparency and more aggressive, quicker adjudication so that people can get those answers sooner. But it's also why the network really does matter. Um, Not all networks are created equal, and you could have an out of pocket cost that's dramatically different if you go with a network that has a strong relationship with that provider. And of course, going in network is really critical because out of network, you can be balance billed, and then the out of pocket costs are much higher. This is also one of the reasons why many of our plans have what's called escalating benefits, where in year two, the benefits increase, in year three, the benefits increase further, because you do have the reality of adverse selection. If I could buy a dental insurance policy today and spend $50 for my first month's premium and go to the dentist and charge $5,000 and then drop the coverage because I don't need it anymore, I got the work done,
Right.
then that does have a moral hazard element and it really undermines the viability of the overall market. So building an escalating benefit to say, we want you to stay with this plan for life, and we want to make sure that your out-of-pocket costs are going to be predictable and really, really low. Having the escalated benefits really helps with that.
We also on this show talk a lot about access for individuals that are either underserved, rural communities. And I'm going to kind of start this off with a more current affairs situation. We try not to get into politics, but there's a lot of discussion about eliminating fluoride. And, fluoride would impact some of these underserved communities in rural areas. So I guess my first part is have insurance companies talked about, what does that mean if suddenly the U.S. becomes unfluoridated, if you will, with water supply, and then how do you help these communities that may be impacted by that?
Yeah, in the industry groups that we're part of, we're starting to see these conversations develop in states that have now gone ahead and banned fluoride. I think the large scale impact of that is really going to be unknown for a whole generation. It's one of those things that's going to take a long time to play out and see. But you're exactly right that people in rural areas, especially, have some real issues with dental access and underserved communities. Teledentistry is definitely unlocking a piece of this. It's making it easier to have that first visit. And if you hear from the dentist on a teledentistry visit, oh, you desperately need to come in, you're more likely to make the 45-minute drive to the next largest town or whatever is necessary. You're also starting to see emerge some mobile dentistry
Mhm.
where they have full dental offices in a van and they can drive around. And these are pretty common in colleges and also nursing homes and some other more rural areas.
Oral health is, I think it has not been as appreciated, but is starting to get better appreciated in terms of its ties to bigger systemic medical conditions, heart disease, diabetes, even dementia. Do you foresee kind of that stronger integration in dental and medical care? Is your company or all looking to the future to where that kind of overlaps, or we're not there yet?
Well, I would say we don't expect it to mean integration of the dental and the health insurance companies, but we're certainly seeing the dentists focus on this a lot and increase their own education of what is a potentially spottable issue that you can see in a dentist chair that could impact their overall health. And so we're seeing a lot more dentists tell patients, hey, I think you got to go see a neurologist or even a cardiologist based on things that they're seeing. And so as more data gets gathered about the link between oral health and overall health, I think you'll see an education campaign for dentists that will make a real difference.
In our final moments, Sam, I know we talked about teledentistry, we talked about AI, but I'm wondering what innovations are you all looking at that could potentially disrupt dentistry, if you will, over the next 5 or 10 years that maybe our listeners, should be watching out for? What's on the horizon as you see it as someone looking at coverage of these items that really could change the game?
Yeah, I think the first thing that comes to mind is robotics. You're starting to see now the first technology startups focused on building robotics that can act as a dentist or that can
Wow.
make a dentist much more effective by seeing a lot more patients or even by guiding procedures remotely. And so I think it's early. I'm not sure in 5 years we'll see that, but I'm pretty confident in 10 years, a significant minority of dental care is actually going to be done more by robots in the office. I think that's going to unlock a lot of innovation and some exciting things. And then you'll start to see some value-based designs, especially for large employers, where they can use better predictive analytics using AI to really anticipate what claims are going to be, to anticipate who might not know that they're going to need to go to the dentist in the future. And then, of course, the dental schools are all studying all kinds of links between oral health and whole body health. And we expect to see a lot more education around that.
Sam, in our last moment, I want to give you this opportunity to address our listeners. You're CEO of a company that provides dental health insurance coverage at NCD. What message would you like to leave to our listeners that maybe they can find useful or actionable as it comes to their dental coverage?
Yeah, I'd say the first thing is please check us out, ncd.com. We're easy to find. We're the highest rated insurance plan administrator in the country, and you'll see why our customers and our employees rave about us. Google our reviews and look around. We'd love to welcome you in the family and spread the smile.
I love it. Sam, I want to thank you so much for giving us your time. This has been a great conversation. We really appreciate you joining us on our program today.
My pleasure. Thank you very much, Doc.
We've been talking to Sam Melamed. He is CEO of NCD, a provider of dental insurance coverage here in the United States. And up next, after your weekly health headlines, we focus on how to decipher medical bills for Financial Literacy Month. And we'll be right back. Hey, it's Dr. Joe Servin. I have a new show called This Week in Health, and it's part of WJCT News Now. Local news you can listen to anytime, anywhere. When you sign up, you'll unlock 4 local podcasts delivered straight to your podcast app. I break down the week's biggest health headlines and what they mean for you. Start a free 30-day trial at wjct.org/newsnow. And if you like it, become a monthly donor to support WJCT Public Media.
Hi, I'm David Luckin of What's Health Got to Do with It? And these are your weekly health headlines. A mini stroke can have major consequences. New findings indicate transient ischemic attacks or mini strokes can lead to the same cognitive declines as full-on strokes. Researchers at the University of Alabama found that even if symptoms of a mini stroke resolve within 15 minutes to an hour, the result could lead to a long-lasting change in people's cognitive ability and could lead to dementia. At least 250,000 Americans experience a mini stroke each year. Symptoms of a mini stroke can include balance loss, changes in eyesight, facial drooping, arm weakness, and speech problems. Those who experience a mini stroke should seek medical treatment immediately if the symptoms seem to resolve on their own. American breakfast cereals are becoming less healthy. According to a new study in the journal JAMA, breakfast cereals are becoming less healthy with more added sugar, fat, and sodium. Cereal boxes tout the inclusion of essential nutrients like protein and fiber, but those ingredients are on the decline. Children aged 5 to 12 are the biggest consumers of cereal. These findings fuel the ongoing debate over the relationship between processed food, childhood obesity, and the rise of chronic diseases. Rough night ahead? Try sleep banking to stay alert. If you know you're in for a rough night, you might want to start sleep banking. Rather than catching up on sleep the night after, try to intentionally get extra sleep during the days before you know you'll have a restless night. Sleep banking is like collecting and storing your rest hours before you need them. This method can help you become more alert and improve overall performance. For some good news, dementia doubled or debunked. A new study claims nearly half of Americans over 55 could face dementia in their lifetime, but critics at Duke and beyond are pushing back, arguing the risk has been steadily declining for decades due to better education, healthcare, and public policy. In truth, dementia rates will rise, but not as extremely as expected. This decrease is due to the rising education levels, reduced smoking, and improved treatment for high blood pressure and cholesterol. And those are your weekly health headlines.
Welcome back to What's Health Got to Do with It? I'm Dr. Joe Servin, and we continue with our show looking at navigating the healthcare pricing maze. Let's meet Carlos. Now, Carlos slipped on his porch and got a quick x-ray at a local hospital. No cast, no surgery, in and out, believe it or not, within 15 minutes. 2 weeks later, $4,100 bill, for which the itemization said $800 for image acquisition, $950 for facility use, and $1,400 for administrative handling. All for this x-ray. Can you guess what made this routine visit so outrageously expensive? Well, the answer is it's the facility fee. This is what hospitals can charge outrageous extra fees, even for basic outpatient services. Plus, each small part of the service, image, reading, paperwork, was separately inflated to maximize the billing. So if you've ever stared at a medical bill and thought it needed a secret decoder ring, you are not alone. Joining us to crack the code is Mr. Scott Speranza. He is the founder and CEO of HealthLock. He's a leading expert in healthcare billing and audits, patient advocacy, and he's made it his mission to help patients fight back against these confusing, inflated bills and take control of their healthcare costs. He's joining us from Nashville. Mr. Speranza, welcome to our program.
Hey, Dr. Joe, thanks for having me. I appreciate that.
We love having you here. And I just shared a case where a simple x-ray kind of brought us into thousands of dollars of charges. Can you walk us through what's happening behind the scenes on a bill like that? And then I'll ask a follow-up on it.
Yeah, of course. Well, so as you know, each episode of care, whether in this case it was going to an emergency room, you said hospital, urgent care, whether you're going to your primary physician, they all have a different bit of adjudication, if you will, against your insurance. Adjudication is just how does your insurance pay for the services that you receive? The other side of that, of course, is, well, how does the provider or the facility or the doctor bill so that they can get reimbursed and paid by the insurance company? This is why it's so complex. You've got literally three parties or more involved in, well, how much should my care cost? So in your specific example of Carlos had something urgent. It wasn't planned. He didn't get pre-approval or pre-authorization with his insurance company. He just said, I hurt my arm. I need to go to the hospital. And then he got a bill. So the first thing is that there literally is, the No Surprise Bill Act and other legislation that certainly is there to help protect against something that is either nefarious or outrageous or just something that was never supposed to be charged that high. So there's a level of comfort, especially in emergency situations, that if there has been something that has been done incorrectly or a blatant overcharge, you've got protection there. So you're probably not going to have a catastrophic bill that is going to be due because of the No Surprise Bill Act that's been passed. Now, on the other side of the equation is, why was it $4,000?
Right.
And this is where our care, and technically it's the only thing that I can think of that you don't know what it's going to cost until after you've received the care, right? And that's the situation that we're in. Now, Dr. Joe, I have to say that I believe that our healthcare system is the best in the world. I think statistically you can prove that. One of the big reasons that we're able to afford such phenomenal outcome of our care is because of the insurance coverage.
I see.
Not government paying for it, not just your private pocketbook at the time of service. No, we have this thing called insurance that allows us to go ahead and do this. I just want to preface that I'm a big believer in what we have. Now, HealthLock, which we now have audited over $500 million worth of consumer claims. We've saved well over now $130 million for our customers. We see this all the time. And so what happened to Carlos? Well, it could have been where it was a denial of service. He went in for something that wasn't covered by his policy, and the insurance company denied it.
Mm-hmm.
And all of a sudden, his out-of-pocket expense went up. It could have been a partial claim denial. Now, claim denials are rampant. About 30% of the insured base in America is going to receive a claim denial this year.
Okay. Wow.
Yeah, it's a big number. And so that means, if you have an ACA approved, an Affordable Care Act policy, you got direct, that has about a 30% denial rate against claims. Your private insurance, it's your employer and so forth, has about a 20% average denial. And then even Medicare has a 10% plus denial rate. So as Americans that are insured, we are going to probably at some point face a denied claim. So in Carlos's case, first and foremost, was there a denial?
Right.
Or partial? And if there was, why? And then what steps could Carlos take against that, which of course would be an appeal and maybe a second appeal or a third appeal, and HealthLock has to appeal claims all the time. And there's about 100 million claims that are denied. The Wall Street Journal says it could be as high as 800 million that are denied every year. So I'll pause here in a minute, but the first thing is the major dollars could have been because there was a denied claim or a partially denied claim, meaning that the insurance company was not going to pay or pay fully what the hospital in this case had asked. And that's the first thing we got to figure out with Carlos. What was denied or not denied? I'll pause there for a minute and we can break this down further.
I appreciate it. Well, Scott, let me kind of take it to the top, because I think as you talk, there's all these millions of denied claims. There's these bills that come in. Even I'm a physician. I don't do the billing, obviously. Yet even when I get bills, they are very confusing, and I'm like, oh, I see what everyone's upset about. So when someone like me or yourself, when a patient opens up their medical bill and they often see those terms, technical component, miscellaneous service, facility fee, are there some big gotcha charges that people need to watch out for that maybe they're negotiable? Walk us through that part.
Sure. Well, there's a maybe a little known secret that maybe most bills are actually negotiable in some fashion, right? And so let's, again, not to make it complex, let's try to make it simple,
Sure.
But we have to understand that, again, somebody, a provider, a doctor, a lab, has submitted to, in this case, an insurance company on your behalf that said, we did these services, please pay us. These are either our negotiated rates or these are market rates, but give us money for what happened. The insurance company looks at it and they do all of their gyrations and calculations, and then they pay an amount. And then a bill is produced to the patient, right? You and I, after that payment or not. Maybe it was paid in full. Maybe it was completely covered. In this case, let's say there's a bill. So the provider is the one that's billing you, not the insurance company.
I see.
If it's a denied claim, you've got to go to the insurance company to overturn that. That's what we talked about before. But let's just say there wasn't a denied claim. It was paid in full. And so now there's a bill outstanding from the provider. Okay. So the question now becomes, what were your prices? What codes did you use?
Right.
Did you upload me? Did you go ahead and give me did you do lab tests that I didn't need? And this is what we at HealthLock call our pre-care advisory services, meaning in your care, pre-care before you get the bill, that's post-care, ask questions. Make sure that you have your eyes wide open to what the doctor's doing, what they're prescribing, and why. If you can get a pre-authorization from your insurance company, absolutely do that. But let's just say that you did all that and you agreed to everything and still you have this bill. The next piece is, all right, well then how much did they charge? This is where it gets hard for the consumer.
Right.
Because there isn't an online database, let's say, that says, okay, I had X, Y, and Z CPT code, ICD-10 is submitted into this magical database and
Right.
outspit, what I should have paid and what I actually paid. Now, HealthLock leverages our data that's proprietary to do that. So we can say in a very simple example, hey, this MRI was charged at $1,500. The MRI down the street is $500, and the one average price is $1,000. Why did you charge $1,500? And so HealthLock equips itself with data to go back to the provider and then potentially negotiate that $1,500 down to something more reasonable from a market standpoint.
I see.
The MRI provider may or may not have done anything illegal or anything that broke your contract. They may have, and there's a lot of fraud and there's a lot of mistakes that happen. About $350 billion worth, by the way. And so, yeah, you got to have your eyes wide open on fraud and something that was, nefarious. But in this case, let's say it wasn't. It's just an issue of price. We think we have the best MRI service. And even though the exact same one was $500 down the street, we charge $1,500. And so the consumer, if you're equipped with the data, can go in and say, hey, I'd like this to be less because I pay a lot of money, $1,500 is a lot of money. Can you please help me? But going in there with some data that says it should have been $1,000 or less, I want to go ahead and negotiate this price. Now that's if you have data. If you don't have data, you also can default and ask, well, what would your cash price have been?
Okay.
Now this is where it gets very dynamic, because the first question now you may hear from a provider when you check in is, do you have insurance?
Yes.
And if you have insurance, they're kind of taught to say, well, the cash price isn't relevant to you because we have a negotiated rate with your carrier. And you think, oh, well, that must be a better rate than cash pay. So of course I'll trust you. And of course you can go ahead and use the negotiated rate and all is good. And then you get that big bill and you're like, well, wait a minute. I thought I had a negotiated rate and I thought that was going to be lower. What is your cash pay price? And normally the cash pay price is less than the negotiated price.
I see.
It's a really good barometer to then always ask, well, it doesn't matter if I have insurance or not. What is your cash pay price on what you're going to do? Now, again, they might not know what they're going to do. They might just say, well, we're going to go and do a checkup, but you may have, a panel test, a more advanced panel test. You may have to go get your heart checked. You may have to do an EKG. We don't know. So, of course, you're not going to practically go through and say, okay, well, give me the cash pay on all those different price points. But after the fact, post-care, billing now, you can then go back and call them and say, hey, I got this bill for $1,500. What was the cash pay for these services if I would have paid cash? Oh, okay. Well, why don't we negotiate this bill against the cash pay amount? And you can do that.
Wow.
The last piece on that, and I'll pause here in a moment, is you can negotiate because the providers all have something they call revenue cycle management. It's collections. It's cash in versus delayed cash. And so if I can get my cash faster, revenue cycle management, I can run my business better, working capital. And so if you say to somebody, hey, I'd be glad to pay this today. I have a credit card ready or an ACH ready or whatever my means, but I want a discount. You can probably negotiate 10, 20, 30% off of that price just because you're ready to pay now.
I love this. And to all of our listeners out there, you're listening to What's Health Got to Do with It on WJCT News 89.9. I'm Dr. Joe Servin, and if you're just joining us, we are talking about deciphering our medical bills, and we want to hear from you. Tag us on social media at jservin. There's a very popular saying. In fact, one of our earliest episodes of this show, we had an author on that basically was a book on entitled "Never Pay Your First Medical Bill," and I'm wondering, is that good advice? Like when you get that first bill, do you just? I mean, I listened to what you just said, and where you can negotiate this nice discount. What do you do about that first bill? How should we process it, if you will?
Yeah, I think the don't pay, now, don't pay your bill until, wait as long as possible. I think that's good advice inside your arsenal, but I think it's dated.
Okay.
And of course, that book is dated, right? And so a lot of times now you go to the doctor or hospital or urgent care, and they're going to ask you to pay up front. And if you don't pay up front, they won't potentially see you unless it's an emergency care situation. But if it's a doctor and so forth, they can choose not to see you because it's not emergency. So at that point, that strategy is kind of thrown out the window.
Gotcha.
And now it's a matter of, okay, after the fact, after I paid something, how do I recoup and get a refund? And this goes back to, well, you can't do it because if I pay you now, give me a 10% discount, you already paid them.
Right.
And so it really goes down to the data. And again, it's hard to find this data. There's really no database online. HealthLock leverages proprietary data, but we go back and say, hey, again, you charge my client up front. Now in the back end, we're doing an analysis that says you charge them potentially 30% more than market average. Here's my market average data. We would like a refund of $100 or $500 or whatever it might be. And that's how we've saved over $130 million for our customers.
No, these customers, and when you're talking about your company, and because it sounds fantastic in terms of really going out there to get, the best price, is that something you engage with before some major procedure, or is that something after something's been done and you're getting all these crazy bills? Who exactly is the customer? Is it a company? Is it the person? Who's working with you there?
Yeah, good question, Dr. Joe. It's both. So we have both a retail product that a consumer can go to healthlock.com and sign up. Their family, everyone in the family is covered. And we're automatically monitoring your transactions, medical, dental, vision, and RX. You're not sending us anything. We're leveraging AI and technology to say, hey, let's go ahead and monitor so that you don't have to worry about it. It's a lot like identity theft.
I see.
Which medical identity theft is actually a value add in our service. And so you just basically, our customers wait for HealthLock to tell them, pay this now because it's been through our audit and we verified it. And this is all online. This is all, tech driven or flagged. We think there's an overcharge or there's fraud or there's something wrong with this. Would you like us to investigate? And our customers have that control to say yes or no. Oh, it's my chiropractor. He's my best friend. I don't want you to do anything. Okay, we're just looking out for you. Or of course, they press lower my bill. We investigate it. We also have an employer benefits service. We're employees of a company. So if HR or the CEO wants to give a service, pay for a service like HealthLock to protect their employees out of pocket expenses, we've been very successful there. We have thousands and thousands of employees that are our customers because insurance has gone up. And for the most part, employers have passed that increase over to the employee with less coverage.
Got it.
So back in the day, we maybe had $250 to $500 deductibles. Today, $5,000 to $10,000 high deductible plans are not uncommon. And so we're paying more out of pocket, and an employer can give a great benefit to protect their employees out of pocket through HealthLock.
Let me ask you just a general sense of like the cost of care. Are you noticing from what you see through your data and things of that sort, is care generally more expensive if you do it at a hospital, let's say a clinic that's attached within a hospital versus one that is independent? I mean, I know quality can vary on these things as well, but what's your sense on that, particularly when it comes to certain fees and things of that sort?
Yeah, Dr. Joe, I wish I had a better answer than it depends and you get what you pay for, right? So quality is absolutely an issue within healthcare.
Got it.
And, you've got things like the Mayo Clinic and Cedar-Sinai that have a prestige value to it. that certainly is going to be more expensive than other systems and other hospitals. Essentially, one hospital over another has higher quality. You can see data. We have HealthHawk does a pro score based on how many times that facility has both done the procedure. So to make an extreme point, do you want to go someplace that's done it once?
I see.
Or do you want to go someplace that's done it 1,000 times? And then also, for the folks that have done it 1,000 times, how many of those patients have had recurring negative issues from that procedure? And so we can begin to get glimpses of the quality against the price. And there just is, again, the simple is the MRI. There literally is probably 100 different price points on the same MRI across the country. Why?
Wow.
Well, some MRI machines are potentially more advanced. It's more comfortable and faster to get into the system, to the MRI. Whatever reason they justify that, there is a difference in quality, and therefore there is a difference in price.
Scott, if someone gets a confusing or outrageous bill, what suggestions or advice do you have that they should do, that the person should do before they pay anything? What would you suggest if someone out there, they get some crazy bill, confusing bill, what should they do before they go and pull out their credit card?
Well, what HealthHawk does first and foremost is it analyzes each claim based on what was paid or not by the insurance carrier. That goes back to how we started, which is, all right, well, if 30% of Americans are going to get a denied claim or partially denied, was that involved in this occurrence, in this adjudication? So the first thing is, if there's anything that's been denied, you've got to appeal. And just statistically, only about 1% of denied claims are appealed by the consumer. And so again, you've got to make sure you go through the process of appealing, which can be daunting. That's why we have lawyers and so forth. As a legal case, obviously HealthHawk does this all day long, and we've got the ability to submit easily, where the average consumer might be challenged. So the first thing is claim denials. The second piece is, again, what are they saying happened? So for instance, if you mentioned in Carlos's case, he was there for 15 minutes. If you see a large charge and you make a phone call and say, well, again, how long did you have me there for? And they say, well, we had you here for a day. Well, then something obviously was wrong, and that probably is something called upcoding. If I see you longer, if I check you into the hospital from my emergency room over 24 hours, I code it differently, and therefore I get paid more. So there is some either, aggressive billing practices or illegal billing practices, whichever way you want to go in that direction, that says, what happened to me and how long I was there, or what kind of lab test did I get? What did I need versus what was, a luxury item? You want to know all those things. And then the third piece is, again, get whatever data you can to understand that pricing, to use data to negotiate, as HealthHawk does. Defaulting to cash pay would be at least a good barometer. Was I overcharged or not, as it relates to at least cash pay?
Scott, I'm going to ask you one of these larger philosophical questions, and I want to kind of get this question in there. If you could wave this magic wand and fix a thing about the way healthcare billing works in America, and you know it because you're handling these claims, you're seeing what's going on. What would be that thing that you think you would change that would really make a difference for all of us, really?
Well, I appreciate that question, Dr. Joe. And I'm going to do this. I'm going to start it off with what I would not do for sure.
Okay.
And I'm not a believer in government-run healthcare.
Got it.
There's this falsity that socialized medicine is working so well in Europe and Australia and all these westernized countries, and it's not. It's a two-tiered system. You get stuck in line. There are literally riots that are happening in Australia because people are not getting care because the government can't afford it. They reduce their cost allocation, their dollars to it, and people are hurting. So don't let it be government run.
Okay.
The second thing is what I believe HealthHawk is doing, which is creating an Expedia online for healthcare. So the way that we no longer use a travel agent, we understand full transparency on what airline tickets cost. and I can do my comparison. I can quality shop. I can go first class. I can go main. I can do all these different things prior to my care. HealthLock has got the database and the tools to be able to go again in pre-care and procure, at least understand what my cost would be, and then procure it. So our next phase is to become where you can actually buy it online. There really isn't a place to do that. And then where everything is connected. So the real magic wand is that still the world of healthcare is very disconnected.
Yeah, it is.
Most people don't know that at a hospital, again, going back to your Carlos example, that there was probably contractors there. They don't work for the hospital. They're actually contracted by the hospital. So they're a third party that now comes in, the anesthesiologist and potentially the nurse or the reception, whatever the cost is. The people that did the labs are obviously not probably part of the system. So they have to accrue all those different bills, then package it, submit it to insurance, and then that turns around and gets submitted to a bill to us. That's very complex, and there could be 20, 100 different billing systems that are not connected. And so this connected universe, if you will, it's kind of like fiber optics to the last mile. We need it to the last mile, where the million doctors out there plus all the systems have a standardized system that we can then leverage the data, so we can create an Expedia online for the consumer that's transparent, easy to use, lots of choices. I understand my quality. There aren't any surprises. That's the nirvana that we would like to build here at HealthLock.
And I'm going to let that be our final word, because I want to leave it on a hopeful note. Scott, I want to thank you so much for sharing so much about how to manage the bill, talking about your very cool company, HealthLock, that's helping all these folks, and for the work that you're doing. We really appreciate it.
Thank you, Dr. Joe. Really appreciate you allowing me to be a guest. Thank you.
You betcha. We've been talking to Scott Speranza. He is CEO and founder of HealthLock, a company that helps with medical billing to help audit what's going on and in some cases get that money back when you've been overcharged. And that's our program for today. We hope you've enjoyed our show. If you missed anything, you can listen to the full episode at wjct.org and on your favorite podcast app. Thanks to all of our guests. Our executive producer is David Luckin. Stacey Bennett is our producer. Brady Quorum is our director. Caden Collins and Caroline Kahn are our researchers. If you have questions about this or any topic, let us know by calling us at 904-358-6362, email us at health@wjct.org, or tag us on social media at jservin. I'm Dr. Joe Servin, and you're listening to What's Health Got to Do With It on WJCT News 89.9 Jacksonville. Thank you for listening, and stay in touch.
Support for What's Health Got to Do With It is provided in part by the American Brain Foundation. Invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at AmericanBrainFoundation.org.
Rethreaded needs you to make a difference in the lives of human trafficking survivors. Learn more about supportive services and an array of survivor-made products at rethreaded.com.
And by Neurelis, a leading neuroscience company focused on the development and commercialization of therapeutics for the treatment of epilepsy and other neurologic disorders. The company's unique drug portfolios strive to address unmet needs in patient care. Learn more at Neurelis.com.